Man is discharged, feels sick, and dies hours later at the UPA here in the Federal District. The Federal District really has a lot going on, huh, folks? I'm going to read this story here for you, okay? There's a clinical part here, a really important clinical part, okay? Silly mistakes that kill people. So don't forget to like and share. Look, this is a real case that I'm going to comment on, and this was a mistake made by the person who attended to the patient. If anyone from the Federal District sees this video, feel free to speak up. Eder from Pratica Infirmagem said, it's a mistake made by the person who treated the patient. Because man, from the report that's here, this is absurd. Shall we go? Let's go now. Here's a quote, okay? Such great neglect. I went in with my father and left with him in a body bag. The account is from Milka Vieira, daughter of Francisco Vieira, 69 years old, who died on March 8 after having a heart attack hours after being discharged from the Gamma UPA. To Metropolis, the radiology technologist said that on the morning of March 8 Sunday, around 8:30 a.m., her father was complaining of symptoms. Back pain, shoulder pain, and shortness of breath. Do you want me to repeat? Back pain, shoulder pain, and shortness of breath. What do you think it could be? Think. It's very difficult. Think. Do you know what's difficult? Imagining what it is. Moving on. That's why he was taken to the medical facility. My brother took him to the emergency care unit. There they did some tests and ordered an X-ray. Afterwards, they said it was a small inflammation in the lung. They prescribed some medicine and he went home, said Milka. According to the medical records, Francisco came in at 8:46 a.m. with back and shoulder pain since the previous day, as well as difficulty breathing. He had a history of hypertension, was diabetic, and was a smoker. The initial assessment indicated suspected chronic obstructive pulmonary disease exacerbated with a possible lung infection. So, hold on. The X-ray then revealed that he had COPD, chronic obstructive pulmonary disease, with an infection. However, a few hours later, at 1:50 p.m., remember it was in the morning, right? At 1:50 p.m., he started feeling unwell again and went back to the emergency care unit with severe shortness of breath, but they were still calling it this silent pneumonia thing, and he was short of breath. When I arrived to stay with him, he was very breathless and already had an oxygen tube in his nose, says Milka. Guys, here's the general rule. If you work at an ER, an emergency care unit, where you receive patients, stick with me here, stick with me. Every patient who comes in with pain anywhere in the chest area gets an ECG right away, so we can rule out the possibility of a heart attack. Got it? The chest isn't just in the front. The chest area includes the back too. So the chest is a box. It has an anterior and a posterior part. A heart attack isn't just that textbook concept where it's in the front and goes to the left arm. Man, it's the chest where there are two organs, the lungs and the heart, two organs. There's nothing else except these two organs there. So anyone who says they're having pain in their back or in the front, man, do an EKG. Damn it, it's cheap. I don't even know how much it costs, but an electrocardiogram is cheap, and for the government, it costs nothing. Just do the damn electrocardiogram. Even an X-ray is a cheap test to do, and you can do it, man. Before ruling out the possibilities, we need to understand what the guy has. If the guy has DPLC and all that, fine. The guy had a heart attack, man. Bro, the guy had a heart attack. The guy had a cardiac arrest. The guy had a heart attack. Or if there's really nothing wrong with the heart, the guy is struggling to breathe out. What happens when that happens? CO2 increases inside the body, so CO2 goes up, pH goes down, there's acidemia, respiratory acidosis, and in a matter of hours, the guy can go into cardiac arrest. Let's go. Everyone who goes into cardiac arrest gives a warning 8 hours before. The guy arrived at 8:30. At 1:45, he came back again. Shall we do the math? 8:30, 9:30, 10:30, 11:30, 12:30, 1:30. Shall we put 2:30? Look, in less than 6 hours, the guy had a cardiac arrest. That's how hard it is to study. That's how hard it is to understand what happens in other people's lives. Guys, for God's sake, come on. It's about sitting down and studying. So the guy who came and has a recurrence, okay then. If at 8 in the morning, the person who saw him sent him away saying he had a silent pneumonia, an infection, whatever, the guy came back, the guy had a recurrence. Decisive, the guy's condition got worse and he was short of breath. And then what did they do? What did they give the guy? For God's sake, they gave him oxygen. And what do I say? Oxygen doesn't solve anything. Oxygen doesn't solve anything. If it did, the guy wouldn't have gone into cardiac arrest. Oxygen doesn't fix the pH. Oxygen doesn't fix the CO2. Guys, how long will we keep losing people due to bad doctors? This is for doctors too, those providing poor care. I don't even care now. Let's get to the part where we make the final diagnosis. Medicine is terrible. The federal district with doctors who give horrible care. They gave the guy oxygen. Man, if the guy has this, get a blood gas, intubate the guy. He needs to remove CO2 from his body or he'll go into cardiac arrest. He did. Now, he didn't necessarily go into cardiac arrest because he was having a heart attack. It could be because of acidemia. He was going to go into cardiac arrest. Remember the HZTs, according to Mary Karras? I mean, she's been an expert in this for many years and sets protocols for the whole world. There are HZTs, genetic, which causes acidemia, respiratory acidosis, expiratory. Guys, it's hard, isn't it? But people go to work because they think it's cool to put the stethoscope around their neck, put on the lab coat. But for God's sake, you have to know what you're doing. Otherwise, a lot of people are going to die. People are already dying, right? So, is it a death that could have been avoided? Well, just looking at this data, maybe he would not have gone into arrest. Looking at this information, maybe the clinical outcome would have been different. Maybe he would not have gone into arrest if they had already done an electrocardiogram. It could have shown a heart attack if he actually had one before the cardiac arrest, or if he went into arrest because of respiratory failure, since the X-ray showed COPD and pulmonary alcohol. So, if he went into arrest, it wasn't a cardiac cause, it was a respiratory cause that led him to a cardiac arrest, and it's really hard for us to treat someone in an emergency. That's why in my postgraduate course in emergency and urgent care, it's mandatory for everyone to take a triage module where everyone who does the emergency and urgent care course will learn about classification. From that, you have to know what you need to do when the person complains. Chest pain, no matter how the patient presents, chest pain has a specific protocol. In fact, there's even a huge protocol for chest pain that we're going to cover. Because man, there's no way you can work on the front line and not know how to handle chest pain, because otherwise it gets difficult and a lot of people will die.